Imagine your mood isn't just happy or sad. It swings between extreme highs where you feel on top of the world and crushing lows where you can barely get out of bed. That's the reality for millions of people living with bipolar disorder. I'm Dr. Anim, and today on Health Made Simple, we're breaking down bipolar disorder in plain language, what it is, the different types, and how it's treated. Let's get rid of the confusion and stigma and get to the facts. Bipolar disorder is a mental health condition where your mood swings between two extremes. Think of it like a swing set, but instead of small, gentle swings, you go really high and really low. The high periods are called mania or hypomania. During these times, you might feel super energetic, need very little sleep, talk really fast, or make risky decisions. The low periods are depression. You feel sad, hopeless, exhausted, and lose interest in things you normally enjoy. These aren't just regular mood changes. These episodes last for days or weeks and are intense enough to affect your job, relationships, and daily life. About 1 in 50 people worldwide has it, and it usually starts in the late teens or early 20s. There are a few different types, so let me break them down. Think of them on a scale. Bipolar 1 is the most severe type. You know someone has bipolar 1 if they've had at least one episode of full-blown mania. What's that? It's when someone is so up that it causes serious problems. They might go days with almost no sleep, spend all their money, believe they have special powers, or even lose touch with reality. These episodes last at least a week or are so severe the person needs to go to the hospital. Most people with bipolar 1 also have periods of deep depression. Bipolar 2 is different. People with bipolar 2 never have full mania. Instead, they have something called hypomania, which is a milder version. During hypomania, you might feel more energetic, productive, and confident, but it doesn't ruin your life. You can still function. The problem with bipolar 2 is the depression. The depressive episodes can be just as bad as those in bipolar 1. And because the up periods feel good, people often don't realize anything's wrong until they crash. Then there's cyclothymia, the mildest form. Imagine a kiddie roller coaster. The ups aren't as high and the downs aren't as low, but the ride never really stops. This goes on for at least 2 years. So what causes bipolar disorder? It's a combination of your genes and your environment. If a parent or sibling has it, you're about 10 times more likely to develop it. Brain scans also show differences in brain areas that control emotions. But genes aren't the whole story. Environmental factors like major stress, lack of sleep, or drug use can trigger episodes in people who are already at risk. Diagnosing it can be tricky. On average, people wait 5 to 10 years to get the right diagnosis. Why? Because there's no blood test. Doctors diagnose it by listening to your story and ruling out other conditions. The biggest challenge is that when someone is in a depressive episode, it looks just like regular depression. If you don't mention the high periods, you might get the wrong diagnosis. And that matters because antidepressants alone can actually make bipolar disorder worse by triggering mania. The good news? Bipolar disorder is very treatable, usually with a combination of medication and therapy. Mood stabilizers are the main treatment. They help keep your mood from swinging too high or too low. Lithium is the oldest and most proven one. Other medications like antipsychotics can also help, especially for mania. Therapy is also key. Cognitive behavioral therapy, or CBT, helps you recognize negative thought patterns and develop better coping skills. And interpersonal and social rhythm therapy focuses on keeping your daily routine stable because irregular schedules can trigger episodes. Beyond that, lifestyle is crucial. Keep a regular sleep schedule. This is one of the most important things you can do. Avoid alcohol and drugs, exercise regularly, and build a strong support system. Living with bipolar disorder means managing a chronic condition, but it's highly manageable. The key is staying on your medications even when you feel good. So here's the bottom line. Bipolar disorder causes extreme mood swings. Bipolar 1 has severe mania. Bipolar 2 has milder highs but serious depression. And cyclothymia has chronic but milder swings. It's caused by genetics plus environmental triggers, and treatment involves medication, therapy, and stable routines. With proper care, most people can live full, productive lives. Bipolar disorder isn't a character flaw. It's a medical condition that deserves treatment, just like diabetes or heart disease. The stigma around mental illness keeps too many people from getting the help they need. If you found this helpful, please like, subscribe, and share. Drop a comment. What mental health topic should I cover next? I'm Dr. Anim, and this has been Health Made Simple. Take care of your mental health, and I'll see you in the next video.